Welcome to another episode of TeaTalk. On our show today is Suzanne Williams, our registered acupuncturist here at Red Tree Wellness. Welcome.
Thank you very much.
I hear you're going to talk to us today about Tui Na.
Yes, I am.
What is that?
So Tui Na is a traditional Chinese medical manual therapeutic technique. It was used as early as 5,000 years ago to alleviate pain in the muscles. Tui Na, the words actually mean push or press, and na or grasp. And so that tells you basically what it does. We're using our hands and other tools to massage and manipulate the muscles and soft tissue, but also points on the acupuncture channels.
Can you tell us a little more about the difference between Tui Na and massage that we know today and other orthopedic treatments?
Sure. So Tui Na is often used, of course, as a massage technique, but encompasses a wide variety of other techniques too. Acupressure is very important. And we also use things like joint mobilization and stabilization. And we even use other tools like gua sha or scraping, cupping, and moxibustion as well.
Oh, great. And you're going to show us some techniques today?
Yes, I am.
Great. Looking forward to that.
So our model patient today is Christina, and she's got some shoulder issues going on, particularly around the scapula and the back. We've done an orthopedic assessment, and we found some really tight bands and tightness in the front as well. So I wanted to show you a treatment of the front today, because oftentimes we forget about the front when we're treating the back.
Right.
So it's really important to do that.
Right.
So I'll show you some of the techniques we use. This is called circular kneading, and it's very nice and deep. Gets into sort of the bigger muscles. Okay, and she also has some tight bands across here, so I can do some plucking along the biceps tendon as well, kind of soothe that out.
Is Tui Na only used for muscle aches and pains?
Not at all. We actually use it quite often for internal conditions as well. Some of the more common ones are things like colds and coughs, asthma, indigestion and other digestive disorders, especially lower belly. We can use it for edema and insomnia, and also for neurological conditions as well, like post-stroke tightness or one-sided weakness, facial paralysis, as well as numbness and headaches.
Sounds like a lot.
A lot, yes. That's just a small part of what we can do.
Right, because you're simply going along the acupuncture channels as well, or part of it.
Exactly, yes.
Okay. What about for kids?
Sure can treat kids with acupressure. It's actually wonderful. Kids are great candidates because oftentimes they either can't sit still with needles, or they're too small for needles, or they don't like needles. So we can use acupressure. And kids are actually very responsive to it because their bodies are so full of energy that they can also balance out with just a bit of acupressure.
I think they'd be great candidates. What is this technique you're doing now?
So this is called grasping. Yeah, Christina's turned her neck nicely for us. So it can actually grab along the muscle. And this is not a muscle we get into very often, but I can grab it. I would also do some soothing with some oil as well. And so I can press along the muscle. And then I would do some digital pressing as well. So especially around the insertion point here. So I would work with Christina on some breathing and press in, breathe in, and as she breathes out, I'm going to press into it and do a little shake, and that helps to release that area of tension.
Thanks for showing us.
You're very welcome.
That was a really great demonstration. Thanks for showing that to us.
You're very welcome.
So how would you close off and summarize Tui Na for us?
So essentially, the big difference between Tui Na and other orthopedic or manual therapies is that we can also treat internal organ systems as well as the nervous system inside the body using acupuncture points, just as we would in acupuncture or with herbs, but instead of needles or herbs, we're using our hands.
Right. That makes sense. Hands instead of needles, using the acupuncture meridians. Excellent. Thanks for being on the show today.
You're very welcome. Thanks for having me.
And before you leave the show, we always do this with every person we have on the show for the very first time. A little get to know you, a few questions.
Okay, sure.
Okay, so if you are coming up to a pool, are you the kind of person to cannonball in or slowly dip into the pool?
I'm kind of a dipper.
Oh, you're a slow
Adjust myself,
person.
yeah.
Okay, favorite food?
Oh gosh, I would have to say blueberries right now, this time of year.
Good.
Yeah.
And best thing to do on a rainy day?
Oh, I actually don't mind going outside on a rainy day because it's quieter. I like going to Spanish banks and splashing around in the puddles with my young friends.
Nice. We'll see you at Spanish Banks.
Yes, definitely.
Okay.
Thank you.
Thanks for being on the show.